Hello, everyone. It's October the 7th on Wednesday. Regretfully, again, I've got to report to you that we've lost 8 more additional West Virginians since Monday. Our 362nd death was an 82-year-old male from Kanawha County. Our 363rd death, a 64-year-old female from Cabell County. 364th death, a 72-year-old male from Cabell County. Our 365th death, a 56-year-old male from Kanawha County. Our 366th death, a 65-year-old male from Kanawha County. Our 367th death, a 67-year-old male from Wyoming County. Our 368th death, a 72-year-old female from Harrison County. And our 369th death is an 81-year-old male from Fayette County. Oh, I sound like a broken record, don't I? But it is so important to me and my family, Kathy, all of us, and all West Virginians, that these people, these great West Virginians, don't become just a number. You know, please keep all these people in your thoughts, your prayers, thinking of them, thinking of all their families, all their friends, all their loved ones. It's a catastrophe beyond all of our abilities to comprehend. A pandemic. None of us would have ever really thought it was possible, but it's here and we're getting through it. There's so many of our indicators that are better, but it's still tragic to these people. So please, like I said, always keep them in your thoughts and your prayers. Now, I want to just say this too, that, you know, one of the great people that works with me every day is Jordan Dameron. And he just went on, just keeping on. So West Virginia, you're superstars beyond belief. I love you with all my soul. And sure, we are dealt a tough hand and a cannonball right to the stomach, but we're going to get through it. We're getting through it. We've got great, great West Virginians we've lost, but we're going to win the war. Surely we have problems in the battles, but we're going to win the war. And for that, I hope and pray we always remember all those we've lost and all those that are helping so much. We have a nurse's death that we have that we've learned about just a little while ago, that a nurse at the Ruby Memorial Hospital in Morgantown has now died. In addition to that, we have a death of an employee that was a nurse at the Bateman facility for more than 10 years. And I want to make sure that I get this right, but also an employee of the Mildred Mitchell Bateman Hospital has died as a result of this. Bateman is located right outside of Huntington and has it is one of our 2 psychiatric hospitals in the state. This employee was a nurse and worked at Bateman for more than 10 years, as I said just a second ago. We should continue to remember all these first-line responders. These are the real heroes. Now we have lost 2 nurses within our state, and just imagine that if you were one of these great people and you get up this morning and you know you're going right not to the fire, you're in the middle of the fire. And you know you come home, your family's there, and all their loved ones, all your friends, You've got to protect yourself to the very best of all of your abilities and everything. But even with all that level of protection, we still lose our great heroes. You know, just the other day, and I'll mess this number up, but I think they were paying tribute to 60 some odd, or it could have been 40 some odd, policemen in New York City that have died from really COVID and absolutely trying to do anything and everything they could to try to help people. That's what these people do. They know the job is dangerous when they take it, and they know that there's trials and tribulations that they're going to have to go through, but they never ever thought they were going to have to sign up for a pandemic. So absolutely, these are true heroes, and please, please keep them close to your heart as well. We've had 203 new positive cases in the last 24 hours. Our daily positivity rate is 3.27, from yesterday. Our cumulative positive rate is now at 2.77. We still have just a little over 4,000 active cases and right at 12,500 recovered cases. We have 168 people that are hospitalized, and our reproductive number, our effective reproductive RT number, is at 0.83, which is now the second best in the nation again. And that's really, really, really good stuff, because that means whatever we're doing is working from the standpoint of our mask and our testing and isolating and finding those spreaders and cutting them out and everything. And, it's working. I know we still lose people, and we're going to get through this some way, somehow there, but what we're doing is working. We have no counties in the red on our color-coded map. We have only one county in the orange, and that's Upshur. And we're working to test more and do everything we can possibly do to help those people in Upshur. And as we test more, what we'll do is just what I have said over and over and over. We will find those that we would not find any other way. And when we find them, we will ask them, or we will some way contact trace. We will isolate. We will help them get well, and we will prevent them from spreading this disease to more and more and more. And we just keep running the same Groundhog Day over and over and over unless we can find the spreaders. So by testing more, test, the more we test, the more we'll know, and the better off we'll be. Today we're going to be in Upshur County, with doing additional free testing. I encourage everybody in the county to come out and get tested today, because it will help not only you, it will help all of us to find out information. If we just pick up one spreader, we'll be able to stop this thing right in its tracks, but we can't do it unless we know. We have 18 outbreaks in our schools right now, with 50 confirmed cases in the public school system reported by the Department of Ed. Again, we continue to handle this in a really, really good manner and everything, and we hope and pray nothing happens, that it gets worse and everything, but right now we keep running to these fires and putting them out, and really and truly, I think we're doing a really good job with this. Our long-term care facilities we have 41 outbreaks in our long-term care facilities right now. We have 13 outbreaks in our churches in 9 counties. Mason and Doddridge are new counties that have joined Upshur, Logan, McDowell, Tucker, Harrison, Fayette, and Kanawha counties. We want to strongly urge what I've said over and over about a pew in between, and wash your hands and wear your mask, and think really hard, if you're one of the elderly, about whether or not you should be in church this week or not. And I surely respect your wishes in every way. If you go, protect yourself like crazy, and If not, you can skip a few weeks and everything and get online services or whatever it may be. It may be better. From the correction standpoint, we have 4 cases that are active only now. We have 2 at Mount Olive, 1 at North Central and 1 at South Central. And the guard is back, doing additional sanitation missions in different places as well. From the flu vaccine, get your flu shots. It's the only smart thing to do. Get your flu shot, please do. It's painless, there's nothing to it at all. I mean, just get your flu shot. From the standpoint of the CARES money, it's going out to the cities and counties. We've now sent out $140,347,049.39 have been awarded to the cities and counties. We continue to ask them, continue to apply. We're going to continue to send the money. From the standpoint of the census, we're at 99.9, tied for first place in the country. Way to go, West Virginia, way to go. Now think about this. 3 years ago in West Virginia, we went to the polls, did we not? Now it wasn't the polls, to elect individuals, to the statewide offices or to our legislature or whatever it may be. This was a special election. It was our Roads to Prosperity Amendment. It basically was the road bond referendum. Now, I very, very, very proudly can say that, I ran myself ragged going all over the state, talking to a lot of people and doing town halls, and I had a million questions and everything, and most of the questions centered around, well, we've heard this stuff before, but what happens is after the fact, then our taxes go up like crazy and our roads never really get built. Well, that's surely not what's happened here. And so on this 3rd anniversary, I think we all in West Virginia should share in a celebration and a real celebration. We have now got over $1 billion of major infrastructure improvement projects that are underway or finished, and I just can't say enough about just this. West Virginia, naturally it takes a leader. It takes someone to come up with an idea. It takes a legislature to pass and act on that idea. And then we really turn the ball over to you, don't we? Well, when we turn this ball over to you, in a lot of different situations, this bond would have been defeated. It took a lot for you to really believe that this was real. It took a lot to believe that there would be thousands of miles of roads that would be either built or improved upon or ditches pulled or all these crazy potholes taken care of and everything. It took a lot to really believe and trust in this. And then go to the poll and get out and vote. And 73% of you voted in favor of doing this. So really and truly, West Virginia, it took somebody to come up with an idea and it took a legislature to pass it. But at the end of the day, West Virginia, you deserve the credit. And that's great with me. It's always great with me. You deserve the credit for all the great work that's happened and continues to go on. And so today is a really special day. A special day for our Roads to Prosperity. Now, the other thing I'd like to report just real quick is we continue to do great work on broadband in our state, and we've got hopefully some really more exciting announcements to make in the next few days or the weeks to come, and we're just going to keep at it. I congratulate Kanawha County today. I just saw this just a few seconds ago or minutes ago, but Kanawha County has now gone from blazing red to gold. We thought, my gosh, how good. We went from red and hot as a firecracker to orange and we just couldn't get out of the orange and everything. And then all of a sudden, lo and behold, we drifted in the gold. Fantastic Kanawha County, but today you're in the yellow, and that's really, really good. So keep it going, Kanawha County. We're going to get these numbers down. We're going to get this infection down, and we're going to shut this thing down, not only in Kanawha County, but we're going to shut it down all across our state. Again, remember all those we've lost in your thoughts and prayers, and let's just stay at this. That's all I got.
All right, thank you, Governor. Let's first today go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to also talk just for a second about the strategy we're taking for the public health map that we're publishing, that we're using also for the schools. I just want people to remember the reason why we have added at the governor's challenge to us, added the percent positive rate to the incidence rate. People have been reaching out and have been saying, why don't you just use the infection rate like we have seen from sources like the Harvard Global Health Institute? And that's a really important metric to use in public health settings. But as you remember, what happened is that that rate only counts the number of positive cases we have each day on a 7-day average, and it doesn't account for how many tests that we did to get to those positive cases. So what people were recognizing, and local health officers, local health departments in counties, were that counties were reducing their testing because the citizens figured out, and a lot of people figured out, that if you reduce the testing, maybe you would find fewer cases. But as the governor has said, the really important cornerstone, the real way that we're going to help West Virginia stay healthy, is to identify those few people, that 5 to 9% of people who become infected. And in that 2.5 days or so before infection, up to that day of infection, they can be highly contagious, and they can spread to other people without even realizing they're sick. And they're called super spreaders. And that 5 to 9% of people has been found to infect 80% of everybody who gets COVID. So ultimately, the way to identify them is to test. And that's why we added that percent positive rate. And we used national standards. We chose below 5% to get from that orange color to gold color. But the idea is that we want people to test and test and test. And we have seen that change. As the governor said, our reproductive scores come down. We still see too many West Virginians dying, but that rate seems to have come down a little bit. And our tests are going way up. We've almost doubled the number of tests after we've changed the metric. And for counties like Kanawha County, as the governor said, it provides an incentive for them to get tested so that they can bring those numbers down. And because we are testing more and identifying some new people, which is so important, because if we can identify some of these super spreader people, then we can really substantially impact positively the health of West Virginia. But what we will see initially is the infection rate will go up. The Harvard metric will go up because we're identifying more people. But as we can get those people isolated and not able to infect others, then we know that over time that infection rate will come down too. So what we're really looking for is we're looking for an approach, as we have continued to evolve our strategy, to be able to test a lot, to be able to identify people who could be super spreaders, isolate them using contact tracing, reduce the death rate and the amount of COVID spread in the state of West Virginia in each one of our counties, and then also increase the number of tests that we do and keep that rate overall below 5% and even below 3%, which is even better. So West Virginia, we are working hard to try to make sure that we are providing the right tools for people to be able to be safe. And again, this map is not done to try to open all the schools. This map and this approach is done to try to reduce the spread of COVID-19, which makes schools safe, but also which makes West Virginia safe. And thank you for all you're doing to make that happen.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. We've gotten reports from a lot of local health officers that they have noticed some other signs and symptoms that people have reported for COVID-19, that it's not just the fevers and the cough and shortness of breath that people have reported. They're also noticing people have had symptoms such as allergies or body aches or general symptoms of just not feeling well. So we encourage everyone out there that if they're having other symptoms, even the loss of taste or smell, or even allergy symptoms that are not your normal, to go and get tested. This is another reason why we have ramped up our testing across the state, that it is available to everyone nowadays, and that we are seeing these super spreaders or people that are not normally having the symptoms that they have during this season to go and get tested. Because as Clay mentioned, there are people who are having these symptoms or asymptomatic spreaders out there that are causing these cases that we are seeing. So we encourage everyone to not just look for those symptoms of a high fever or shortness of breath to get tested, because our local health departments are reporting these cases to us. Thank you.
All right, thank you, Dr. Amjad. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Thank you. Good afternoon, everyone. As the governor mentioned, we are sad to report that an employee of Mildred Mitchell Bateman Hospital has died as a result of COVID-19. This employee worked at Bateman for over 10 years. She was a wonderful mother, daughter, and co-worker, and she received many accolades for the outstanding job she did at Bateman. So it's always difficult when we lose West Virginians, and this was one of ours, and we're just deeply saddened. Our thoughts and prayers are extended to the family, and she will truly be missed. Thank you.
All right, thank you, Secretary. And last to Major General Hoyer with the West Virginia National Guard.
Good afternoon. On behalf of the National Guard, we'd also like to extend our condolences to the family of our fellow state worker. We will keep her family in our thoughts and prayers. Today, we received notice that FEMA will allow us to add to our cap of Guard personnel, so we'll go up to 400 employees, guardsmen, who will be 75% federally reimbursed. That will allow us to increase some additional support to DHHR epidemiology. We'll go up to 70 personnel supporting that effort. Exceptionally important that we continue to support DHHR in that effort. Today, we had personnel in Nicholas County at the request of Secretary Crouch and Dr. Amjad. We're providing some additional support to Nicholas County to address some manpower issues in that particular county. As the governor and Dr. Marsh pointed out, it's about testing and about wearing our masks, and we are going to put a particular focus on supporting DHHR, local health departments, and some new initiatives that we will roll out related to and continuing to ramp up the testing over the next couple of weeks, and disinfection missions continue. I'd like to leave you with two last things related specifically to the National Guard. Unfortunately, today is the anniversary of the 1992 C-130 crash, where 6 National Guard personnel died in a training accident outside of Martinsburg. So we ask that you keep their families and their memories in your thoughts. Also, today marks 20 years since the start of Operation Enduring Freedom. I think it's important to know the role that West Virginia plays, and one of the first Special Forces units in Afghanistan after the September 11th, 2001 attack was a West Virginia National Guard Special Forces company led by some folks who still serve in our organization, but also the commander of that unit was retired General Russ Crane, who now works for DHHR. So we thank those folks for their great work and all the folks who have served over the past 20 years attempting to keep our nation safe. Thank you.
All right, thank you, General. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. With the president testing positive and coming down with COVID-19, have you taken any additional steps to safeguard the staff there around you? And could you talk a little bit about what they have to go through on a daily basis in order to talk to the governor?
Well, Paul, we've taken additional safeguards, that's for sure. We've, if around me all the time, that we've tried as hard as we can to just keep real familiar faces around me, and if we have a meeting like we just had, with people that weren't normally around me all the time. Of course, everybody in the meeting always, everybody's wearing masks, and as I go around the state, yesterday I spoke at a couple of different places, and I went to Tiger State Park yesterday, and we were able to award, or do a whole lot of renovations and upgrades to not only the lodge, but to roads and the boat docks and all kinds of stuff like that. And so from the standpoint of the governor getting around and going, I surely need to go. It's expected of me to go. I want to go, and I'm going to go. But within all of that, now we've taken extra precautions, from the standpoint of people taking pictures, and they kind of rope off an area, and it's just it's a crying shame, from the standpoint of what we've got to go through. But we better take heed to any and everything we can to try to be as safe as we possibly can. And those things that we do will only lead to others being safe and others not exposed to this dreaded disease, because the bottom line is, if it can invade the White House in the United States of America, it can invade anywhere. So we all need to be super safe. I offer up my apologies for not being able to shake people's hand and hug people, and because I'm that type of person. I love West Virginians. I think they're the best of the best, and so, but right now we've all got to be just as super safe as we can be. We'll get through this. There'll be a vaccine, and there'll be all kinds of times for us to be back embracing one another as we always have. But yes, Paul, we've taken some extra precautions, that's for sure.
All right, thank you, Paul. Next to Brad McElhenney with West Virginia Metro News.
Oh, hi, Governor. Quick follow-up. You had a meeting. What kind of meeting was it? But also, my real question is, the House of Representatives, Congress, passed the latest round of federal relief for COVID in May, and then a revised version of it at the start of October. But there's been no broader agreement yet among the House of Representatives, the U.S. Senate, and the White House. Last night, the president tweeted something that indicated negotiations should stop until after the election. What's your understanding of where matters stand at the federal level, and how important is the latest round of federal relief to West Virginians? Thank you.
Okay, Brad, what was the first part of your question? I got all the rest of it, but what was the very first thing you said?
Oh, you mentioned in passing that, to Paul Mullen's question, you mentioned, well, I just got out of a meeting, which tripped my curiosity about what it was about. That's all.
Well, the meeting was about broadband. We continue to try to work, on that and everything. You'll hear a whole lot more about that in the days ahead or the weeks ahead. But you see, at the end of the day, from West Virginia's standpoint, so many things. And here's how I just see the whole deal. I mean, and this is how I saw the whole thing from the day that I came in the door. First of all, we had to go on an out-and-out campaign to be able to change our image. So the first thing I thought we needed to do was make education our centerpiece. Put a stake in the sand on that. The next thing I think we had to do is we have to have highways. We got to have roads. We can't go to the convenience store and tear our vehicle all to pieces going to the convenience store. And right behind that, we got to have broadband all the way across this state, do we not? And there's so many other things, diversification and tourism and all the different solicitations of business and opportunities coming to West Virginia, all that. But those are three cornerstones, that's for sure. Now, Brad, back to your question about the next stimulus package. You know, the Democrats and Nancy Pelosi have come out, and they came out in the beginning and said, we want to do $3 trillion. The sticking point is really simple. They wanted to bail out a bunch of Democrat states and Democrat counties, or Democrat cities, and I mean Democrat by the leaders of those states, the governors, or the mayors of those cities, had run up these ungodly pension liabilities, and they wanted money to bail them out. And the Republicans are saying, wait a minute, now hold on, stop. You know, we want to be fiscally responsible, and we don't want to just throw money into something where people have mismanaged and not done their job. It's absolutely reasonable in every way. So there's an impasse, boom. And we can't get off get-go. Now the Republicans are at a point in time where the Republicans are saying, we're good with $1.6 trillion. Good heavens to Betsy, you know. And the Democrats are saying, we want 2.2. Now, I really have believed, and it would be more Christmas comes early to West Virginia if there's a stimulus package passed. We don't need it from the standpoint of where we are right now. We have done amazing work with where we are, but we will have need as it goes forward, and there's so many others that are out there that are either lost their jobs or having tough go and everything that we can help. And absolutely so. With all that being said, our president tweeted out the other day, he says he's going to postpone this till after the election. I don't want him to do that, and I do not think that's the thing to do. Because after the election, one side's going to win, one side's going to lose. And whatever side loses, it's going to be difficult on them. And from the standpoint of the lag, the time, you know, you just think, Brad, I mean, right this minute, you've got restaurants that are super struggling. You've got all kinds of small businesses that are still really struggling. You've got people that are sitting wondering how in the world they're going to make it because they've lost their job, their unemployment benefits, their bonus monies and all that kind of stuff is gone. What are they going to do? And so from the standpoint of postponing it, terrible. I just think that's not good. So from the standpoint of a hope in every way, you know, very quickly the president pivoted and said, well, wait a minute here. Let's try again to try to get this thing finished and across the finish line. And I hope to goodness, you know, I don't want to be disrespectful, but what goes on in Washington, good gracious, it's ridiculous. It's beyond all good sense. I don't know how any living human being can make a rational thought out of let's defund our police. How could anybody come up with something like that? But with that, you've got the sides, both Democrats and Republicans alike, and all they want to do is do the next gotcha to the other side. And I see Washington just that way, a gotcha deal. The people don't matter. The people should be the only thing that matters, but they don't matter. Really, it's just the next gotcha move and the next soundbite. So I don't know. I wish to goodness that reason would prevail, but I don't know if the the last stimulus package will come this way or not. I sure hope it does, but that's all I can give you as far as the update on all of it.
All right, thank you, Brad. Next to Jade Burks with WVVA.
Good afternoon. This is Jade Burks of WVVA. This might actually be a question better suited for Superintendent Burks, but for several days here in Mercer County, we've had one or two bus routes that couldn't run because there aren't any substitute bus drivers. Just wondering if this is a widespread issue across the state that we're seeing, and if anything is being done to hire additional personnel. Thanks.
I can answer it, I think better than anybody else on the call, but let me just say this, and it's not very well. Superintendent Burks isn't here. He can answer it a whole lot better than I. I know we have a critical situation with substitutes, and we're doing everything in the world from being able to let the young people that are in our colleges and everything, from the standpoint they're doing their student teaching, that they could be an active substitute and get paid for it. Our State Board of Education is doing an amazing job recruiting people and everything to try to do any and everything that they can possibly do to fill these jobs and fill this need. But it's a real need and it's a real problem, but they're working on it. That's all I can tell you.
All right, thank you, Jade. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you recently said you were working on plans to get the bars in Mon County back open. Could you give us an update on that and give us an idea of the kind of precautions and regulations that would be in place to prevent a repeat of what happened last time we opened the bars? Thank you.
Charles, I think, we'll have a whole lot more on that on Friday. And I know that my general counsel, Brian Abraham, is in conversation with these people and everything. As far as the guidelines and stuff, all we want is just this, the level of spacing, the mask, different things that are just the normal protocol. We got overloaded there and everything, but I'm real hopeful that we can move forward with getting those businesses back, because you got employees and you got the same kind of situation. You got business owners, employees that need the job, need to work, and we ought to be able to figure this out, to be able to handle this in a safe manner.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Thank you. It's Kenny Bass with Channel 8 and Fox 11. Governor, hearing a lot of concern, as I'm sure we all are, from parents and teachers and workers and community members about students being in school, and just not because of numbers or because of metrics, because of maps, but because of not following recommended CDC guidelines. In many schools, and I've got pictures to prove it, they're just not 6 feet apart. There's mask wearing isn't being mandated, it looks like, very seriously or closely. I think Dr. Marsh even said in response to some questions he was asked by people that it's certainly not the best way to go, in a manner of speaking, only spacing students 3 feet apart instead of 6. So if we're serious about this virus, if we're serious about being safe, if we're serious about the government taking away the rights and privileges of people in order to curb the spread and to try to keep as many people as possible not sick and not dead, how can we justify putting kids into schools where they're only sitting 3 feet apart and they're not wearing masks and they're not doing the basic things that we say have to be done in addition to testing in order to curb the virus? Thank you.
Okay, Kenny, let me ask you a question back, and then I'll answer your question, and I'll answer it really well, I think. How many people have we lost in the United States? Just rough number. How many people have we lost? How many people have died in the United States of America? Do you know the answer to that? Kenny, can you hear me?
Yeah, Governor, I can hear you.
Did you lose me there? Okay, I'll do it one more time.
I'm still with you.
Okay, how many people do you, and roughly, just a rough number, I know you don't have to have an exact number, but how many people in the United States of America have died with the COVID disease?
The CDC estimates that about 210,000 Americans have died thus far because of the coronavirus pandemic.
Now, the reason for that, and we could go back and forth because, Kenny, I love you to death and we're friends, but we could have a real discussion about this, but I'm just gonna take it from here. But Kenny, the reason that both of us know that 210,000 Americans plus have died is one thing, and that is our freedoms in this country lead us to being, in some ways, surely more difficult to instruct or manage or whatever. And we go our own ways, and that is what has made America so great in so many ways. So, the things that you may see at a school in which we depend on all the local superintendents, on all the principals, on all the local health departments, the things that we set up as the guidelines, the things that you see where people are not abiding by and not wearing their mask or not socially distancing or whatever that you see are just a snapshot of what America really is all the time. And whether it be, that we're spoiled in some degree, or whether it be, we just become lackadaisical, or whatever it may be, we are trying, Kenny, we are trying. We are telling these principals and the superintendents and everybody, and if we have a situation to where they can't be anything but 3 foot or whatever apart and everything, we've given them all the flexibility in the world. We've given the parents all the flexibility, saying to the parents, if you don't want your kids to go to school, we'll do it online. We put up all the points of light to be able to do it online. We are doing every single thing that we know that is capable of us to be able to do. Now, in that, you're going to have this, Kenny. You just are, and we're going to have to. We're either going to have to buckle down and continue to try to do better in every way, or an alternative would be just to do this. And just imagine this. If we had not come up with the percent positivity compared to just infection, just the Harvard map, just think about this, West Virginia. Just think. Just in the Harvard map, if we would have said, well, I'll tell you one thing, we're just going to stay right to that map. Our deal is better. I don't care what the people at Harvard say. Our deal is more right than their deal. Now, the bottom line is just this. If we had just done the Harvard map, we would have a third to a half of our schools and half of our state shut down right now. Is that the right thing to do? I mean, really and truly in a state that has the best numbers of any state around, would that be the right thing to do? Would that be what West Virginians would like? I can't buy that. I can't buy that at all. And not only that, from a standpoint of just this, if we did that, how many people would we lose? I mean, you think about all the kids that are special ed kids or whatever it may be, and need to school so badly. I mean, where would we go? What would we do? And so I just tell you that whether, no matter who it may be, the local health officials or the county superintendents or the principals or whomever, I can tell you that we got a lot of people doing a lot of really good work, but a lot of the problems and a lot of stuff that causes an outbreak in a nursing home, because we tell people not to go to Myrtle Beach and still they do, and still they walk right back into the nursing home and they're coughing or whatever, and then all of a sudden we have 15 people die there. Like it or not like it, but America. That's why we have 210,000 plus deaths in America. But it is also why we are the most powerful nation on the earth. It is also why our freedoms have made us the engine that runs the entire earth. Now, sometimes our freedoms can cause us difficulties, and we got to live with it, but that's just it. And Kenny, if we had that discussion, I know we'd agree with one another, but anyway, thank you a bunch.
All right, thank you, Kenny. Next to Mark Curtis with Nexstar Media.
This probably seems like an obvious question, but I've got to ask it, and I'd like the governor and Dr. Amjad to respond. You mentioned the success of Kanawha County, but tonight marks the first night Kanawha County will have high school football. I believe we're the final county in the state to host any games, and we have 4 games tonight. What's your advice to people going, fans, players, coaches, everybody? This is going to be a big deal tonight.
Well, I hope, Mark, I hope they'll protect themselves and they'll socially distance through the stadium. And I hope that what they'll do is sit there and be really proud of those kids. And I hope they'll all have a great big smile on their face and enjoy the right that we have to be able and the opportunity that we have to be able to go back to something that's halfway normal. And I couldn't be happier for them. I really couldn't. I know that there's always some level of risk, especially till we get to this vaccine. But I think tonight they should really celebrate. And I'm really happy. And we've, by the grace of God above, we came up with a new metric and everything, or Kanawha County and Mon County or whatever may have been doomed forever. So I hope they have a great time, and I hope everything goes really well. And we're going to keep up our testing in Kanawha County. We're going to keep it up in any of our counties. And you see, Mark, at the bottom line of the whole thing is just one thing, and that's just this: if they'll just come and get tested, we'll find the people that are spreaders, and we'll stop this thing. To the very best of all of our abilities. It's the only way in the world we can find them. You're not going to find any eggs on the egg hunt if there's no eggs out there. We have got to be able to have the test. So please, if the people that are going to games, if they'll do one thing that is the most important thing for me, is this: enjoy the game. Love the kids. Love the kids. And then, if they would, please look and go get tested. Every last one of them. Go get tested. Because you may very well be the one. You may be the one that we save your life, that you don't get really sick. And you may be the one that is going to infect others that will die. And so if we can find you, we'll help you. And we'll stop this thing.
All right, thank you, Mark. Next, we'll go to Kimberley Keggy with WSAZ.
Good afternoon, Governor and panel. This is a question for Governor Justice in particularly. And this is something that you've mentioned several times over the last couple weeks, but there have been reports to our newsroom that community leaders are flooding testing sites to increase the number of negative tests in a county in order to withdraw those numbers down and help get kids back in person for learning following the school's county alert system. So what is the balance in helping those get tested who are asymptomatic and the balance of those who are flooding those testing sites? Thank you.
I think 2 or 3 things. First of all, by those flooding the testing sites, you're getting a better cross-section of the entire county than if we were just testing the sick. I mean, that makes complete sense, does it not? The other thing that it does is it does tell us that these people want to go back to school. There's such a need to go back to school. Every state in this country, with the exception maybe of not states, but maybe D.C. and Puerto Rico, other than that, Every state in this country is back in school in some way or another. Now, don't hold me to every specific, but we want in this nation to be back in school. There's nothing wrong with people flooding a testing site because they want to go back to school. But the beauty of the whole thing, the beauty of everything is the more they flood, the more we'll find spreaders. I love it. I love it to death that the more they flood, absolutely, it could not possibly be better. You know, we found 85 spreaders last week in Kanawha County. What's it worth? Tell me, what's it worth? I have said this so much. What is a life worth? Do you not think that one of those 85 would have infected somebody that would have died? 85 spreaders we found that we'd have never found in just Kanawha County last week. What's it worth? What's it worth? I mean, for crying out loud, when it really boils right down to it, if they flood the testing sites, more power to us. We learn more. They want to go back to school. That's great stuff with me. Now, do we protect the school? Of course we do. Do we absolutely do any and everything we can to ensure that our teachers, our service personnel, and everybody are super safe? Of course we do. I mean, do you really honestly believe that I, in any way, would want our kids, our teachers, or our service personnel in a situation that could absolutely, knowingly cause them more harm? Of course I wouldn't. I mean, really and truly, at the end of the day, what we're trying to do is stop this thing, shut this thing down right now. And you know, we're talking about all the different, everything, all the protocol that you can do, you know, from the standpoint of being able, or all the PPE and all the different things that we can do, from testing with Dr. Amjad to anything in the world that we can do to make things better and safer. And that's what we're going to continue to do.
All right. Thank you, Kim. Governor, back to you.
Okay. I got kind of wound up right there and everything, but I love the fact that you know, let me say this, you know, our teachers are doing great work, our service personnel, all the people that are in our Department of Ed and everything, they deserve to be commended in so many ways. You know, all of the health officials on the call and the health departments and everybody that's done incredible work. And I can never thank them enough. And I always want to say that we, and it's not much I to it and everything. And you know, if I give you an opinion and I say I'm meaning we, because that's how this whole boat has sailed, and 134 briefings. It's hard for me to imagine. Gracious sakes, it's while they've been tough, time does go on. It's been an honor. It's been an honor to navigate through this with you, and so with that being said, I'll leave you by just saying this. You know, I wish those that are going to be at a football game on Friday night in Kanawha County, I wish them the very best, and I'm happy for them. And you know, I just think back about the fact that just in a matter of a very, very short number of days, even though that short number of days may be 134 more, and if that is 134 more, there'll be lots and lots and lots of life beyond the 134 more. And I hope and pray that it's a fraction of the 134 more when we have a vaccine, or we have identified the spreaders, and we have numbers that are absolutely spectacular beyond belief. So keep doing the great work. All the people in Upshur County, come out and be tested today. Please, please, please flood us. Flood us. You know, I can't say it any more blunt, but somebody identified to me, just somebody identified to me, what is one life saved worth? You can't do it. You just plain can't do it. And so if we can just stay on top of it and everything, and we can continue to test and everything, like I said, we found 85 spreaders in Kanawha County in a week. We'll find some in Upshur County, and we'll stop this thing. So, just try if you can to get out and get tested. And if by chance you would test positive and everything, we'll repeat the test to just make double, triple sure. And there won't be any just false positives, around and everything. We'll try to repeat as much as we possibly can, to be able to make sure. But anyway, thank you so much.